Hi everybody! I am so excited to be one of the presenters for the 2019 Women on Fire event in Brighton, UK. So thank you to Michelle Lyons and Jenny Burrell for inviting me. My name is Shelly Prosko. I'm a physiotherapist and a yoga therapist in Canada. And I will be presenting on two topics. So the first one will be an hour presentation on compassion-focused therapy. And then the second presentation will be an hour and a half of an experiential practice component, and that will be enhancing pelvic floor health through yoga. So for the compassion part, what I'll be speaking about is really what is compassion-focused therapy, why it's important, what the science is saying about compassion and the benefits of compassion. And at first glance, it seems kind of common sense and you know, why should we be talking about this? Of course, compassion is important, you know, is what we probably all think, and we probably are all fairly compassionate caregivers and people. But I want to, you know, expose you to what some of the research and the literature is saying, and how we can actually train compassion, and that there are actually things, you know, there are fears and blocks and resistances that can happen that prevent us from providing compassionate responses. So I want to talk about that. And also I want to talk about really what is compassion. Sometimes we think it's just being kind and, you know, being nice, but there's a lot more to it. So I'm going to unpack compassion and the different components. It's not just a feeling and how it's a behavior and an action. And we're going to talk about the difference between empathy and compassion, which is important, and the myth that some of the compassion science researchers are talking about compassion fatigue and the myth surrounding compassion fatigue potentially, and how they're perhaps calling it something different. To give you a little hint, we think it might be more empathic distress. So that's where I'll really be talking about, you know, empathy versus compassion, and should we be training one or the other? Can you have too much empathy? Can you have too much compassion, etc.? So it's a really great topic, and I have lots to share, and I'm hoping there'll be lots of discussion and questions as well. And even though that's not, it's more of a presentation style part, like session that I'll be doing, I do want to provide you all with a self-compassion practice, and we'll just do that when you're sitting all on your chairs, and we can just do it right there. It's a mindfulness sort of meditation, self-compassion practice, because compassion is not compassion without self-compassion. And I'll be talking a little bit about what the research is saying surrounding self-compassion, and how that can be important for us as health caregivers or fitness professionals or life coaches to practice self-compassion, but also for our clients or our patients, how we might facilitate self-compassion in them, and the benefits and what the science is saying about the benefits surrounding self-compassion practices. And then the second session is a little bit longer. It'll be an hour and a half, and that will be the experiential practice. So that will be enhancing pelvic floor health through yoga. And what we'll be doing there is just a variety of really inspiring and fun and empowering and educational yoga practices, gentle yoga practices for all levels. And what we'll do is I'll have a combination of pelvic floor awareness practices, visualization practices such as mindful movement and breathing practices, mindful meditation practices, and all of these practices will be geared towards enhancing pelvic floor muscle relaxation, pelvic floor muscle engagement, help facilitate that full excursion of the pelvic floor in timing with breath and in timing with the other synergistic muscles. So it's a combination of pelvic floor awareness and visualization, all with breathing and movement, and we mix it up, and it's just a lot of fun. And really my intention there is to help you all have an experience to connect to and be more aware of the pelvic floor, and then you can take that knowledge and that experience, and on Monday you can use that, whatever you take from it, in your in your sessions with your clients or your patients, or maybe it's just for yourself. I'm really excited to find out that this year's theme of Women on Fire is authenticity, because it just so happens that the two topics that I'll be speaking about are very closely related to this concept of authenticity. And I'm really excited to hear what other presenters have to say about authenticity, what it means to them and their perspective, and then also all of you who will be attending. Hopefully we have some great conversations throughout the weekend about what does authenticity mean to you, because I think it's a term that is used quite a bit. It's more and more popular these days, and I think it means different things to different people. So for my two topics, for the compassion-focused therapy topic, authenticity really does come in here, because in compassion-focused therapy, we're really trying to gain a more in-depth understanding of and gain more insights into our patients or our clients and their needs, and also ourselves and our needs. And that way, when we can gain that clarity and that insight, then we can provide a more fitting or appropriate, compassionate response for the patient or client, and then also for us, and together as a partnership within the context of the environment. So, that's one way to sort of look at authenticity. We're acting and we're doing things from a true place of truth and clarity, and trying to meet the needs that are in line with the client's value and our values. So that's kind of a little sneak peek at how authenticity will fit into the compassion-focused therapy. And then the enhancing pelvic floor health through yoga part. Yoga is inherently an authentic path or practice or approach. So yoga in and of itself, the term yoga, to yoke, unite, body, mind, breath, spirit, it's really an ancient wisdom practice that is promoting our path to self-realization or self-actualization. That's really what the tradition and the foundation of yoga is. And I could talk for hours and hours about what that means to me and what some of the yoga scholars have wrote about and what that means. But just briefly here, the concept of yoga is this path to self-realization or self-actualization or truth. And it's a process, and it's a path of exploration, of curiosity, and it's a path that takes us to more clarity and insight into our own truth or our own self, and we connect more to our true self, so that then we can connect more authentically to others and the world around us. And supposedly with yoga tradition, that helps with gaining more insight into our suffering, and then help therefore to alleviate suffering if you can gain that clear insight. So there's a lot of tones of authenticity throughout all of yoga philosophy, and I'll be integrating this yoga philosophy into the practice, and I do that just by the way I will be using yoga philosophy to inform my language and how I cue, which includes how I cue the pelvic floor. So with all that said, we'll see you in Brighton, UK, April 27th to the 28th, 2019. I am genuinely so excited. Thank you for inviting me and for welcoming me. See you all there.